Welcome back to the Ed Show, and thanks for watching tonight. Our next guest, Senator Ron Wyden, is on the Intel Committee. He's going to comment on screening cargo in this country to keep passengers safe across America. But first, this story. The Tea Party, of course, is coming to Washington with the righties, and their whole mission is to repeal the new health care law. It's at the top of their to-do list. And, folks, we just can't let a fringe minority exert their radical agenda on a law that is going to save lives. The more people that are covered, the better health care we get. It's that simple. Now, they want to get rid of the federal mandate. And, you know, there's an argument to be made there. I want single payer. Most Americans do. Now they may both be able to work into the system together. Now, progressives, listen up to this. This could be a huge step forwards in getting a public option in your state. Senators Ron Wyden and Senator Scott Brown of Massachusetts have come up with a plan that would tweak the current health care law to allow states to implement alternative systems. But there are some catches. For more, let's bring in the senator from Oregon, Ron Wyden. He introduced the Empowering States to Innovate Act. Senator, good to have you with us tonight.
Thanks for having me, Ed. And remember, if you just repeal this law, you would be going back to the days when the insurance companies could hammer somebody for a pre-existing condition. In effect, going back to the days when the only way the insurance system worked would be to have somebody healthy and wealthy.
Well, the McClatchy-Maris poll just out says that 59% of the American people like the pre-existing condition. 51% of the American people want to keep the health care law. But as you brought it up, that 59% of the American people are with the pre-existing condition. So there's a lot of good things out there, yet we're being told by the right-wing conservatives that we've got to repeal this law because it's a government takeover. What are you proposing to states if they can enhance the bill that's in place right now?
Ed, what Scott Brown and I are saying, and I think it's something that progressives and conservatives can come together on, is that what works in Springfield, Oregon, won't necessarily work for Springfield, Massachusetts. What we ought to be doing is creating the opportunity for folks to go to their legislature, advocate their own point of view, and our proposal essentially lays out that if a state can meet the coverage requirements in the law, if the state has, for example, those critical insurance consumer protections, they can show they have an affordable plan, isn't going to add to the deficit, they can pass a bill and they can get the federal government, the Obama administration, to sign off on it. I think it's something that can bring both sides together. Conservatives have always said they believe in states' rights. Progressive folks have their ideas as well.
How did you get Scott Brown on board? He's going to catch hell from the righties on this.
Well, first of all, Oregon and Massachusetts have been two of the states that have consistently been interested in innovation. As you know, we elected John Kitzhaber in our home state. He has been in the vanguard of innovation. In fact, my state was one of the first to say that you could use dollars for seniors that were earmarked for nursing home care for home care.
Okay,
we were always trying innovative approaches.
But getting Scott Brown on board, I mean, there's going to be a lot of Republicans that are against this. Is this an admission that what they've done in Massachusetts has been measurably successful? Your thoughts?
I'll let Scott Brown speak for himself, but I think he's taking the classic conservative position, which is we ought to empower the states, that the federal government doesn't have all the answers. The federal government is not some repository of wisdom. That's what's so attractive about our approach. There are philosophical underpinnings that will appeal to both progressives and conservatives.
Well, maybe Oregon and Massachusetts will lead the way.